Well, good evening, everybody. Just thought I'd give you another little update on things. Number one, I'm having to sit on the floor because I have to charge my phone. Number two, wanted to sport my hair. It's grown in a little bit. Getting reflection on my glasses. Take those off. Um, so this is kind of like a little educational video. By any means, I am not a doctor. I'm not an expert. If I misspeak, I apologize. Don't take my information as your medical information. Okay, these are things that I've just researched and looked up. So kind of that I wanted to share with you, things that have been on my mind. Um, so did you know that less than 10% of breast cancer is hereditary? I did not know that. I thought, oh, it doesn't run in my family. What? Yeah. There are 4 stages of breast cancer. Each stage depends on the size of the tumor, the lymph nodes involved, the grade of the tumor, and what hormone receptors or proteins have been found. Okay. And you're like, what? Because I didn't know what any of that stuff was. So a little education on some letters and words that you might hear. All right, ERPR stands for estrogen receptor and progesterone receptor, also known as HR or hormone receptor. Then you have HER2, which is human epidural growth receptor. So, these are proteins that are, I can't read. HER2 proteins are receptors on breast cells, okay? Normally, they are responsible, they control how healthy the breast is, how the cells divide, and how it repairs itself, okay? And I may be wrong on this number. I think there's 4 types of tumors. Maybe there's like subcategories, but 4 types of tumors regarding breast cancer. Again, I could be totally wrong. So there's ERPR positive, remember ERPR, hormone receptor, and HER2 negative. So approximately 70% of all breast cancer is this type. It can be slow to grow, and it's fueled by hormones, either the estrogen, progesterone, or both. Okay, so that's going to completely impact your treatment and whatnot, and any kind of hormones you have to take after treatment, because you look online and you see a lot of people, or I have, saying, oh, okay, I'm done with treatment, I have to take these hormone pills for 5 years, 10 years, it's making me gain weight, hot flashes, things like that. Okay, that's not for everybody who has breast cancer, just depending on what type of tumor you have. Then you have ERPR negative, HER2 positive. This says about 10 to 15% of breast cancer is this, and it's very aggressive. That is what I had. Yikes. So for my treatment, a lot of people say, oh, why did you have chemo first? Why didn't you have surgery first? And blah, blah, blah. So it is an aggressive tumor, and I couldn't figure out what to do. My oncologist helped me, and he told me that to do chemo first, which I'm very grateful for him. Dr. Tumala at Mercy Hospital, Springfield, Missouri. He's awesome. I'm so glad that we did chemo first because it shrunk the tumor down, because when my surgeon called and said what they originally thought was a 2 centimeter tumor was 5 centimeters, which is pretty, it was pretty big. So the chemo shrunk all of that down, and I was able to have a lumpectomy instead of a mastectomy. So if you have a mastectomy, you don't have to have radiation. You have to have chemo either way. If you have a lumpectomy, you have to have radiation. So a lot of people say, oh, if it were me, I would just, get it out. Well, I know people are trying to be helpful, but as a cancer patient, you do not want to hear, oh, just have a mastectomy, you get new boobs, you get a free boob job. If it were me, I'd want it all gone. You don't know what you would do until you're in that position. And although it's trying to stay helpful, it just adds stress on to that cancer patient. So I'm very glad that I listened to my doctor and had chemo first, because at 5 centimeters, I was not eligible for a lumpectomy, but because the chemo shrunk down the tumor so much, basically it was non-detectable on my second MRI, I was able to have a lumpectomy followed by the radiation. Then there's ERPR negative, HER2 negative. This is also known as triple negative. And again, around 10% is what I've read of breast cancer is this, and it's also very aggressive. Then I think this is one too, ERPR positive and HER2 positive, also known as triple positive. And again, only about 10% of cancers, and it's also very aggressive as well too. So some interesting information if you have a loved one that is been diagnosed. There's also, depends on the grade of the tumor, which I haven't wrapped my head around exactly what that means. So knowing what type of tumor you have and getting into it and having your medical team explain it to you is very, very helpful, because I look a lot of cancer stuff online, recovery and surviving, and a lot of women complain about, the hot flashes and being thrown into menopause and insomnia and weight gain. Well, that's because they're taking certain hormone drugs because their tumor was hormone receptor positive and HER2 negative. Okay, mine was the opposite. So, so just kind of wanted to educate y'all about that, or whoever wants to know about it. The other thing I want to put out there is for anybody who's had radiation. Radiation side effects are completely different from chemo. I think I've talked about that before, but the other nice little side effect that's coming up from radiation is now that it's hot, whether I'm outside in the shade or just hot, in like I'm working in my mudroom or the sunroom, my skin gets real itchy and real prickly, and it almost kind of hurts. So I do have a radiation oncology follow-up. So I'm going to ask him about that. If anybody who's had radiation knows about that, shoot me a little comment. I think I know how to check my comments. Also, too, I'll be having my first follow-up mammogram, so fingers crossed that everything is good to go and whatnot. And I want to also say to anybody out there who's been diagnosed or who is now cancer-free and is still struggling, because let me tell you, having cancer is a extremely traumatic, beyond belief experience. I am so grateful to my family and friends' support and my medical team and my coworkers and my work, but pardon my French, it fucks with your head mentally so bad. So that's why it's very, very important to reach out to your local breast cancer survivor group and see if you can't get a mentor or somebody that's been through that, who's mentoring other people to help talk them through that, because it really, really helps. So I'm in a much better place than I was even like a month or 2 months ago mentally, but it does mess with your head big time, and it's hard to explain unless you've been through it yourself. And that's why if you're a cancer survivor or if you're going through it right now, really, really try to reach out to people that have been through the same thing you have. As much as your family or friends try to say or do the right thing, there is no possible way they can ever 100% totally understand what you're going through. So yeah, that's all I got for now. Anyway, thanks for watching. Have a wonderful weekend. And again, fingers crossed and prayers that my mammogram is completely fine, which I pray to the Lord above it will be. All right, bye.